I am pleased to report that 8,142 Albertans have now recovered from COVID-19. We've conducted more than 8,200 new tests, and unfortunately we have identified 120 additional cases in the province, which is up significantly from yesterday. This is the first time since May 2nd that we've identified more than 100 new cases in a single day. Currently, 69 people are in hospital, 8 of whom are in intensive care. 2 more Albertans have died. I'd like to extend my condolences to family and friends of all those who've lost loved ones during this time. In addition, we have added 3 new regions to the watch list, bringing the total number to 7. These regions are all being monitored closely, and no additional measures are being taken at this time. While we have additional cases, I want to speak about something that has been especially difficult. This pandemic has been very, very challenging for residents in continuing care facilities. To date, 119 of 165 deaths in Alberta have been residents in these facilities. Protecting residents from COVID-19 has required placing severe restrictions on visits, which helped limit and prevent outbreaks, but also took a toll on those living inside these facilities. Last month, I heard from thousands of residents, family members, and facility operators and staff on the impact these restrictions have had and on ways we can safely relax some of them. There are no risk-free options with COVID-19. This virus is still here, and residents in these facilities remain uniquely vulnerable. At the same time, we must also consider the overall health and well-being of those residents and the risks of isolation brought on by strict, universally applied visitor restrictions. These residents need hope, joy, and connection, just like all of us. Today, I am announcing that Alberta will be shifting from a restricted access to a safe access approach starting July 23rd. With the new policy, each resident can designate 2 support people who will be able to visit indoors for as long and as often as they wish, as long as they coordinate with the facility. Depending on the resident's health, outdoor visits will be allowed with up to 4 other visitors in addition to the resident, no longer requiring the presence of a designated support person. In some circumstances, when it is safe, these other visitors may also be able to visit indoors if a facility has a designated indoor visiting space as a part of their local plan. We have also made another few small changes in our restrictions in the province. Effective tomorrow, we will also be permitting indoor exhibits and trade shows, outdoor vocal concerts and wind instrument performances, and outdoor hot tubs and whirlpools to open. These activities will still need to adhere closely to physical distancing measures and the other public health guidance provided. We are making these changes because the evidence shows us that these particular activities are not adding significant levels of risk, and public health remains a top priority. I absolutely am concerned about our recent numbers and the increase in new cases that we've had, and particularly concerned about the number of cases where we don't know the source. It's really important for all of us to remember that even as we've eased some of the restrictions that we previously had in place, COVID-19 is not over, and we are working closely with Alberta Health Services to make sure that all support is available for contact tracing, for outbreak management and control, and also working with communications to make sure that we are doing our best to reach all different demographics of our population. It's important to note that that risk is not evenly distributed across the province, so we are continuing to see cases in our major cities. We are again doing work to understand how those cases might be linked so that we're able to communicate where there's highest risk. And one of the most significant areas of risk continues to be social gatherings and gatherings where people are not observing physical distancing. I want to emphasize that the numbers that we're seeing today are a reflection of what transmission was happening about 1 to 2 weeks ago. And so the activities that we're seeing today will result in cases in another 1 to 2 weeks. So I am very concerned about reports of people not following physical distancing, for example, on beaches, as we saw this last weekend. I'm concerned about reports of people who are feeling that public health measures are no longer important. And I think that we all need to work together, because ultimately our success in the future is in all of our hands. No one person can solve this by themselves. We all need to think about, what do these numbers mean for how we're going to act and behave in the next coming weeks? Because each one of us can make a difference in the choices that we make.